Well, welcome back, everybody, to another episode of the Your Blank What Now podcast. My name is Marcy Nettles, and I am your host. I am so excited to be here with you again today. And I know I say I'm excited every single episode, and that is because I am, because I truly know that these stories that I'm bringing to you, that I'm spotlighting the journey of people that were in breakdown opportunities that chose to break through, that this could be the exact thing that you've been looking for to help you break out of whatever darkness you might be experiencing right now. So that's what this show is all about. And that's why I get so excited every single time that I get to bring you a new breakdown to breakthrough story. And today is no different. I have an amazing guest here today that is going to be sharing from her heart, full of purpose to serve you. And so I am so glad that I have got this beautiful French Canadian with me here today that's got an amazing accent. So please listen in closely so that you can truly understand this message that she wants to share with you today. So just let me share a little bit with you about her. At the age of 17, Julie Christie was influenced by a female doctor who told her that her uneven breasts were a birth defect and that with simple breast augmentation surgery, her problem would be corrected. She believed the surgeon's words when she was told, "It's good for your life and no one will even notice." The doctor left out one crucial piece of information. They forgot to educate her about the negative consequences on her health. For 30 years, this prosthesis did its damaging work. Julie's testimony lists all the symptoms that have seriously compromised her health. Julie is here with us to tell the story of her journey from day one to the complete removal by a world-renowned surgeon, and how she is now helping to raise awareness for other women around the dangers of breast implant illness. So, Julie, I am honored to have you here with me today. Welcome to the Your Blank What Now show and sharing your story with the What Now tribe.
Hi, Mercy. Thank you for letting me in. So I would like to say to all the ladies who are listening, or other people too, not only the ladies, but I would like to share a little bit of my story because I think that it was not so good for 30 years, but now I can live again. And it's because I heard one story of one lady who spoke out loud in public. And because of that, that changed my life. So now I dedicate my life to change other life too.
Oh, that is beautiful. What a purpose. Way to take that difficult time and turn it into your passion and purpose for serving other people. And you've done that so beautifully. So, as we're getting started here, can you please share with the What Now tribe a little bit more about you and what life was like for you as a child?
I was a little kid, like a normal kid, really active. I loved to play, to laugh, especially laugh, and having a lot of energy. We call me like a little bunny energizer. Nothing was stopping me, and I had so many projects all the time. And I was more like athletic woman, a little girl coming to a woman because I was 17 at that time, and I was already with a mind focused with healthy food, healthy exercise, healthy emotion. I was already like this. And then one time I went to see a doctor, and the doctor say, "Oh, I see you have an asymmetry breast. This is no good for you, for your intimacy. You need to go see a surgeon, and the surgeon will just put an implant inside, and your life will change and you'll be okay." And at that time, at 17, we need to go back where there was no internet and not so much information like we can have today. I thought that it was okay because at that time, you don't question the doctor's decision, and you don't ask yourself it's good or not for you. And I went just in her office, and she showed me that implant. It was kind of beige, and the color beige. And she said, "Oh, this is a new one. You'll be okay. It's a texture one, so it will stay inside of you. It won't move, and nobody will know you have a fake one." And I remember that feeling saying, "Oh, this is so good. No one will know." So because of that, I said yes. Because after that, for the 30 years, I was so stressed that someone will know I have a fake breast. And I got stressed every day, everywhere I was going. Each time I was wearing a bikini or I was wearing a little blouse or shirt, I was so stressed that someone would notice that I have a fake and a real one. And I just, after that, it was my stress every day, but in the same time, it was kind of my real day. You know, you get used to it. So after that, it just go in your subconscious and you don't think about it.
Yeah. Well, before we go further into your experience with the implant, can you explain a little bit? I mean, because when we're talking about you being 17 years of age and having an asymmetrical breast, so one's bigger than the other, how different were they? Were they really noticeable in difference?
The size, what at that time it was like A and a really small A, and I think a big B. But today, as a grown-up woman with two kids and two pregnancies that my baby didn't can come to life. I don't know the name in English when you lose your baby. I don't know the name. I
Miscarriage? Do you had a
had
miscarriage?
had
Okay.
miscarriage. So, but because my body changes, today it's the size like still a small A, and but the other one it's kind of close to big C
Yeah.
because not the same. You know, I grew up in
Right.
all
Yeah.
this.
Well, our bodies change. Our bodies change as they go through hormonal situations, and obviously pregnancy and all of that is very, very challenging for our bodies. So when you were a young girl, before you went into the doctor, was that the reason why you went into the doctor,
No,
or what was the reason? What?
not at all. I was just going to see a doctor for a general checkup, and that's it. And it just when if he's done the general checkup, he just noticed that. And of course, it was a question that I had because I could see I had two different breasts, but it was not to me as a problem. It was just like a question, but it was not like, "Oh, I want to change this. What can I do for this?" I didn't ask those questions. It was just to me, I'm born like this. That's it. What can I do? I'm born like this. It's okay.
Right. And you weren't looking at it as being a problem, right? I mean, you had lived your life clear up until this point, perfectly healthy and
I would,
happy,
yeah,
energetic.
I would because at that time I remember we could buy something. It was like a small round thing, like a not the in tissue. You just put it inside your bra, so outside you look like you have the same, but it's only when you take it out we see there's two different one. I remember that, and I didn't care. I just needed to put it inside. That's it, you know.
Right. Yeah. So you had that little insert that you used to make it look like it was balanced in your clothing. And so when you went and the doctor wanted you to have this implant put in, I can see how being so young, first of all, was your mother or father there with you to guide you or?
My mother needed to come to sign the papers to approve it. And I just remember that my mom asked only one question. She said, "I heard it caused cancer." I never heard that words before. It was in 1988. I was too young to know what it is. And and I was looking at my mom saying, "What are you talking about?" And the doctor immediately said, "No, no, no, this is not possible. She can do whatever she wants. She can do all her sports, and when she's gonna be a woman later, if she having kids, she can breastfeed her kids. and nobody will know. It will not move. It will be like with nothing. Like when she's gonna have this, it will change. It won't change nothing in her life. This is what the doctor said to my mom. I remember that because I didn't understand why my mom asked a question at that time. And I never questioned that question also, you go there, and I was so shy at that time too. I was really active, but I was shy. I wouldn't go over someone and talk over a doctor, especially that, I would not do that at that time.
Yeah. Well, I think that during that time period, because we're the same age, and, I would have never thought to question, a person of authority, someone that had the education that I didn't have, especially a doctor. Doctors have always been elevated as being someone that they know what they're talking about. You do what they say, right?
We trust them. And the doctor, I remember that surgeon, she was a beautiful lady. She had beautiful eyes. She was really quiet, very calm, talking so like another mother to me. She was really kind to me. I remember she putting her hands onto me. It's okay, and she gives me compliments. You have so beautiful breasts. You look so good. You can go in Europe and Saint Tropez island or beaches, and you can wear non how do you say when you don't wear your shirt on, breast.
Topless, right? You can go topless because you had now have symmetrical breasts because they put the implant in, right?
Me, I was really shy because I never show my body to no one. I was really shy at that time, but I understand that she was giving me compliment about the beauty that I was, and I took it like a really a compliment, like, oh, okay, I'm looking good. But
Yes.
and I never asked my other question about that implant because she said to me, I put it and it will be for a lifetime. You don't need to think of this ever again. That's what she said to me. I
Wow.
believed her. And I
That's
and I buy the words that she said to me. It's for a lifetime. Don't need to think about it, and nobody will know.
right. And your mother got her question of it won't cause cancer, right?
Yeah.
And obviously, that is not what you experienced. Can you please walk us through the timeline of your journey with that implant? What symptoms started right away and what your experience was? You kind of mentioned it a little bit, the first experience that you had, the first symptom, and to where that was just stress. You felt overwhelmed, a lot of heaviness.
Yes. First, I should say that the first day she put my implant, it was in May 1988, and the scar never closed. It was a hole, and blood was coming out, and translucent liquid, purple color, green color, yellow color was coming out. And that was a problem, of course. I needed to put tissue inside my bra to absorb those liquids. And she just said, oh, I don't know. It must be your skin. You don't know how to your skin doesn't know how to close the hole that I've done. And then she said, we'll wait and we'll see later. So time passes by until November in the same year. So close to 6 months with that hole. And it was starting to be a problem because it was bothering me a lot and I didn't know what to do. And finally, she said, oh, I need to make you as an emergency surgery because you starting to be poisoned with this because it's all broken inside of you. But she said, don't you worry. I'll take everything out. You'll be just fine. I believed her again.
And this was in the first year. And you're saying the implant broke? Is that what you said? Is the implant burst?
It was broken. And she said to me, as a doctor, I've done a mistake. While I close your skin, I just broke the implant. That's what she said to me at that time. So I believe it was an accident. I believe it was, but I didn't even know what the meaning of it's broken inside. You cannot imagine what it is that an implant is broken inside of you. You don't know
No.
because she never showed me pictures. She never explained it to me. I just knew that I needed to go again to her surgery. And in those 6 months that passed with the broken silicone inside of me, I started immediately to feel swollen, to feel stressed, to feel tired, to feel with symptom of depression, to feel like when I was walking too fast, like I was dizzy, like starting like everything was moving, but the feeling that everything is moving. I don't know the name in this in English.
Spinning. You felt like the room was spinning, kind of?
Yes, and I could not move my body easy like I was doing it before, and I gained weight immediately also. And when she took it out, I remember it was in November, and in December, it was Christmas time. So it was about, I think, 30 days after she took the implant out. She didn't put another one yet. She said she'll put it later. So I had again my small breast and my big one. And my mom I wanted to wear again my dress that I wore in June for my prom because I was a young teenagers. And my dress was so beautiful. It was a black dress with velour. I don't know the name in English. I think it's the same, right?
Yes.
Really soft dress. And then I had like behind my dress a big bow with the the tissue going really low in the back, like I don't know the name in English, but it was a tissue going down, and the dress was all black for my prom. But for Christmas, she said, "Oh, I can take it out and put it in red." And I said, "Oh yes, mom, do this for me." And when I wore my dress 6 months later, later my prom, and only 30 days after she took out the broken implant, I was so small. I was to my first shape of body, like when I was a teenage, and she needed to took out. I remember that because it was like something like, oh my God, what happened to me? And needed to take out 4 inches to put my dress back on my body for only 6 months difference. You understand? I don't know
Wow. So
correctly.
what you're saying is from the time that you got the implant and almost right away you had your prom, but you had gained enough weight that
Yeah,
the dress is a bigger dress. And then later in that same year, when you wanted to wear it, after you had taken that implant out, that swelling and that weight had already dropped off of you in such a quick amount of time, you had to have the dress taken in.
yes, that's exactly. So you understand everything. Yes.
Yes. Wow.
So now that I know all this, I should have paid attention to that first symptom, but I didn't know yet because all the time they say, well, you're a teenage, your body's changing, you're starting to have different hormones, so it's normal. You're finished your high school, you're probably stressed. Are you going to CEGEP? You're probably stressed. So they give all the time excuses to my symptoms, and also what I pay attention to, they give excuses that I'm the one to blame. I'm the one who's eating too much or not eating too much. doing exercise or not doing enough exercise. It was all the time me and me and me, that it was not enough and never good what I do. That is what affected me. Even today, I have self-esteem consequences of that.
Yes.
Yes, it
It's long
affected.
term. It's long term effects for sure.
Yeah, it affected me really, really bad for that. I was never enough good,
Mm.
because each time when I'm gonna tell you other symptoms that I had, and all the time they never believed me, and it was all the time my fault. Yeah, that
Or
was
in
really.
your head, right? Or in your head. Yeah.
Yeah, that's me. I'm
So
not
so
gonna
when so
talking to
when
you. I can feel my emotion coming up, that it really affected me.
yeah.
Yeah,
Yeah.
more than I thought, I think. Yeah.
Yes.
Now that I say this to me, to you, I'm sorry. Now that I say this to you, and I see the emotion coming up to me, I I I didn't I didn't realize, or um, that it was so deep inside, touching me. Now I know. Yeah, now I know.
Yes, absolutely. And it's so good that we have resources that you can reach out to get help, right? There's so many good people out there to support us. So when was it that the new implant was put in, and what started happening pretty quickly again?
Yeah. Oh yes. It happened. She took it out in November, and she put a new one, the same kind of, the same type. She put it in August 1989. So I think it was close to 9 months after that. And the type I had, it's true, I didn't say it. It was the type, they call it MAME. It's from Mayor's Squib from Down Corning. And it's a silicone gel textured made with polyurethane, industrial polyurethane. Did I say it correctly? Polyurethane?
I think so.
Okay. Poly, polyurethane.
Polyurethane, yeah. Yeah,
Yeah.
we'll have to look at that. We'll have to look at that one. But yeah,
Okay.
but
But it's Dr. Blair who said this to me in 2019, but I can say this later. But when she put it inside of me in August, and then I was going to my 2 years of college studies. And for those 2 years in a row, I was in depression, crying and crying and crying. But I shouldn't say depression, because I never felt I was in depression. Never. But I had symptoms like a depression, because I was going to see a psychologist over there, and I say, I don't know why I cry all the time. I cry and I cry, and I don't know why, because I couldn't see why or the reasons I should cry. But I was crying all the time, and I was getting weight again. Of course, I was getting weight. And I started to have so much fatigue. Sometimes I felt, for all those 30 years, was the same feeling. You do things and suddenly, poof, nothing, like a shutdown, like no electricity. Someone turned the light off, like poof. And it was like this for all those 30 years. And I never know when it's going to happen and why or the reason. And I was all the time trying to think, what did I do to make this like shut down? Is it something I eat? Is it something I have too much emotion? Is it something I do too much? I was all the time questioning myself. How come I'm okay and suddenly I am not? And I don't know why. And I had the same also chronic, I should say it's chronic, and for the skin rash. Sometimes my skin, all my body or my head, even my head, I had psoriasis everywhere. It was coming and going. And another time, it was like red spots everywhere, but it was not like a chicken pox. Do you say this?
Yes, yes.
It was not this. It was just like kind of red spot, and then it was going. And sometimes it was another kind of red spot, like all close together, like in all only one spot, and then it was going again. And sometimes that was really weird. When I take out my pants on my legs, it seems like my skin was very clear, and I could see kind of white spots everywhere, but it was kind of weird, those kind of spots, like kind of white and translucent spot everywhere on my legs. And another time it was my vein, it was everywhere. We could see it. And another time it was like bruises everywhere, like I was if I hit myself, but I didn't hurt myself nowhere, but I had bruises everywhere. And that was going on and off for 30 years also. And
Wow.
sometimes even in the ear, inside my ear, it was so dry, dry, dry inside. Yeah. And
Yeah,
I
well,
had,
you've mentioned a lot of different symptoms that you had and you experienced over this 30 years and how you constantly turned inward because you felt like it was something that you were doing wrong. I mean, when we spoke previously and with some information you've shared with me, I mean, you mentioned that you had panic attacks, you had shortness of breath, you had hair loss and extreme thirst. Are there other symptoms that you can think of that you experienced over that 30 years? Wow.
thank you for remembering me those symptoms. Of course, I have like over 60 symptoms. It was terrible. And yeah, I was all the time thirsty. Like I could never get enough of water. And sometimes I was making a joke because I say, it's good I don't like alcohol because I was being honest.
Right.
I was all the time thirsty, thirsty. Like it was a it was something not. Today I know it was not normal because I understand clearly what it is, and it's something that the doctor should have taken seriously. The same thing of my hair. The doctor said that all the time, it's normal to lose your hair. You can lose like 100 hair a day. And I said, no, it's not this. You don't understand. It's not that I lose only 100 hair a day. Like I lose it really too much hair. And that was terrible. And they never grow. They take like 2-3 years to get about 1 or 2 inch long. They never
Wow.
grow. Yeah. Now I have hair. Today they're a little bit shorter because I cut yesterday.
It's beautiful. Looks great.
I'm so happy I have hair.
All right. Well, you like just mentioned 60 symptoms. So
Yeah.
just a few that you shared with me that we haven't talked about yet was the shortness of breath, sighing, not being able to breathe through both nostrils at one time, having extreme headaches, bone pain, muscle weakness, loss of balance, and loss of hearing, along with the skin and the hair and the extreme fatigue, all the things that you mentioned. Can you share with us what some of the lowest points in this 30 years felt like where you really felt alone and discouraged and truly felt like you were dying?
Oh, yes. Oh, that was so terrible. I remember especially 2 times. I was in university the first time. I couldn't walk. Uh, oh, I'm sorry. I have a phone. I'm just going to close.
It's okay.
I'm so sorry. Um, yeah, at university, I couldn't walk properly. I was like, when I was walking, uh, sometimes people would say, hey, is she drunk? Because I was really walking side to side, could not be straight. And I was fainting also, like falling directly on the floor, passing out. And also, I couldn't breathe properly, like when I was going upstairs, like if I want to run in the stair, like go up, up, up. I couldn't do that because my breath was like a shut off also, like like, okay, I can't take no more air inside. And I was all the time like doing like someone bothering me, when you're bored. I was all the time doing this so much that to me it was a normal way of breathing. And when people say to me, "Are you bored? What am I tired? Are you tired of me or whatever? Is it like not enough good what I say?" I say, "No, I don't do this." And people say, "Yeah, you all the time making noise, like you're bored." And after I said, maybe they're right. Maybe I do this and I don't know. And I thought maybe it's because I'm a preborn baby. And I said, maybe my lungs are not enough big for so much air, because I really didn't know why I could not breathe anymore and run like I was running when I was young. And that was no good. I remember that. And later I could feel inside my throat, feel like my heart will come out from there. And I all the time say to the doctor, I can feel my heart beating like equally, not like poop poop poop. It was not, it was too fast, and it was sudden, and it was too much, and it kept me awake in the middle of the night. I said it's not normal, and they never believed me, of course. And also, if I continue with the sleeping, I can say that I was doing many nightmares, and my body was moving in the night, and I could feel inside of me uh, my body coming so hot, like my body was heating inside, really too much hot, and I could not breathe also. And finally, after like I think close to 15 years telling the doctor I could not breathe during the night, finally they gave me a CPAP machine so I can sleep. And I said to them, thank you. It works a bit, in the sense that I was feeling that inside my lung was feeling better, less pain in the back, but my brain, I keep telling them that my brain was not um, in a deep sleep. I could not relax my brain.
Mm.
And they say I'm too stressed again. I have too much in my head. I don't know how to relax. All the time was me the problem. And I need to say all those symptoms, because after that, I'm going to say what happened to me after I got explained.
Yes.
And yes. And
Yes. You know,
also,
you
the
had mentioned to me that you had felt like you were dying. And I remember back when I was going through a lot of this myself, and I remember telling my husband, it's like, I think I'm dying. And I just had an aha. It's like, I don't know if it's because we think that we know what dying feels like, but we definitely know what not living feels like. So you not being able to breathe, not being able to move, not being able to sleep, that's not living. And so
yes,
we just think that that is what dying is like. So wow.
yes, it was a feeling inside that something is wrong, and that you have no way to see it's gonna be something that's gonna stop or have a end of this.
Yes.
And inside, I remember I phoned one of my sister on the phone, and I don't know the name in English, but I said to her in French, je suis en train d'agonir. And I'll try to explain it in English, but it was a way of saying to her that it's my last day. I could feel inside of me that something is really wrong, and probably in few weeks or few months I'm gonna be dead, because the doctor doesn't know what I have. And I had the feeling that when they're gonna find out, it will be too late. And it happened to me also about 4 years before I got explanted. So I called all my friends, because now at that time I was a mother, of course. And I called all my friends, and I write my testimony. And I said to her, like, if I'm gonna die, you need to take care of my kid. You'll do this, and then you take care of the house. You'll sell this. And I was telling each of them. I think there were 6 at the table. Tell them, each one of them, what to do if I'm gonna die, because I really felt that was the end. And after that feeling, I turned out to be invalid, and I could not walk properly. I could not lift up my arms. I could not take juice inside the fridge or milk, because it was too heavy. And I could not hold my in my hand my phone, just like holding like this and just to chat. I could not do this. I needed to hold my right arm with my left arm, because I had my implant in my right side. So the right side was worse than the left side. And then also I could not um, I could not turn my head to the right side. It was blocked, like my neck and all my head was blocked. And also I could not turn it, but my head was kind of uh, inclined. I don't know if it's a good name. Like it was like if I stay, my head was
It was like tilted to the side. You were tilted
yes,
to one
yeah,
side over the
yeah.
other.
Yes, that's it. Yeah, it was like this all the time. So we can see it on some pictures. My head was all the time like this, because I could not put it straight. And also when I was doing some exercise at the gym, or when they do tests, a physical test to see if you have muscle, blah blah blah, and they never understand why I was more strong on the left side than the right, when I'm I'm a right I'm a writer. How do you say when you do
When you're
everything
when you're
right?
right hand, yeah, you're
Yeah,
right-handed.
yeah, I'm a right-handed, but I was stronger on the left one. And they say it's not possible, because you all the time stronger with the hand you use most. And me, it was the opposite. And then I say again, maybe it's because when I was young, I broken my arm and I needed to do everything with my other hand. Maybe it's because of that. So
Yes,
I'm,
making excuses and
yeah,
finding reasons, right?
excuses again. Yeah.
Yeah. So you talked about having all your friends around the table and talking about what your wishes were for your children and your estate if you died.
Yes.
Um, Obviously you didn't die. Thank goodness, right? Thank God for that.
Yes.
Right. Amen. Amen. So how did you learn that it was your implant that was making you sick? How did you learn about breast implant illness? And what led you to the understanding you needed to have it removed?
It was a coincidence. I was invalid, so I was not at work. I was
So let
out
me
of.
let me correct something right there. You're not invalid, you were an invalid.
Oh, okay,
So,
good.
an invalid would mean not right, and
Okay.
an invalid is someone that does not have their full abilities physically.
Yes, you're correct. You have the good pronunciation. Thank you.
No, that's okay. I just wanted to make sure everybody understood what you were saying. You have such
Yes.
a beautiful accent, and sometimes in the translation, it comes a little bit
Okay.
off, just or invalid.
Yeah. Okay. Thank you so much. Yes, you're correct. So I could not work. I was at home, and it was 2 years I was at home. Could not work anymore because I was getting worse and worse and no good. And yeah, it was so worst because I could not swallow anymore. And like I was like eating only like fluid. I could not eat food anymore. Even fluid was no good, like water. When I take it, it was coming out from both sides of my mouth because I could not swallow enough. And esophagus was hurting too much. And when the food was passing, I was about to faint all the time because I felt it was blocking inside. It was no good. And so I had many symptoms coming up, like my earring. I was losing my capacity of hearing. I needed to have hearing aids all the time. And my head was hurting so much on the left side. I felt like I had a tennis ball inside because it was so huge and so painful. And in the back of the head, on under the, I think it's the same name in English, it's occiput, octopus,
Occipital, occipital.
yeah, thank you. I felt it was not a tennis ball, but a golf ball, the size of a golf ball in the back. And I had pain like hell. And all my spine, each
Vertebrae, vertebrae.
yeah, thank you. All this, I felt each one of them was breaking inside. The pain, I could not stand it anymore. When I was going up from bed to up or sitting down to up, I felt my body at like 100 years old because it took me so many minutes just to get up. And sometimes only thinking I need to get up, it was already too much. And it was painful in each joint I had, each muscle. I felt weak. And then at that time, one day the TV was open and I heard a little lady, a young one, with her lawyer, and she was on a TV show. And the title of the TV show was Symptoms of Breast Implant. And I said, maybe it's this I have. So I just recorded and I listened when I had the capacity of listening to the TV. And I listened to it very carefully. And I said, wow, this is my life. And I didn't know what kind of feeling I should wear in my heart because should I get upset? Should I cry? Should I be angry? Should I, I, I don't know. I didn't know what, should I be happy? I didn't know what to wear in my heart because it was too much in the same time. I was shocked about the information. And inside of that interview, they show another program. It was a documentary. And inside of this one, they talk about uh, how the explant was supposed to be done and why. And they presented the doctor inside, the surgeon, and they presented her, and then they presented also Dr. Blais. It was a chemist analyst for the implant. So I just made a little research. I found the two-person, and I started to read on this. And more I was reading, more I was going, wow, oh my God, how come? Oh, so many groups, all those women, they have the same problem, the same symptoms. Why? How come I don't know? Why the government didn't phone me? Then I got it to be really shocked and so angry about everything. And then I said, okay, I need to be this out of me. I'm sure now this is what I have because I have this for 30 years. And I went to see my doctor and I told her, not only I told her, I printed two pile of information like 4 inches high. So it means 8 inches high of paper. So it was like over 1,000 papers I printed, like in 1 week. like I read like too much, and I printed everything I was reading. I bring this to my doctor and say, "Here, I found it. You don't know what I have. I know. It's not in my mental health problem. You say to me, like I say to you, it's not this. I said it's a physical problem because I keep telling you I'm not feeling good physically. Now I found it." And you know what she said to me? "You know, Julie, it's impossible because you have this for 30 years. It cannot be this." And I was so shocked. And then I look at her, and for the first time, I took a little, my breath was so small, but I took a breath to just to go back of what she just said to me. And I said, "You know what? You're right. It's 30 years I'm like this. And I had this for since I'm 17, and that's why I'm like this for those all those years. And I was not like this when I was young, before my 17 years old. So if you don't believe me, I'm gonna continue my research, and I'm just gonna go and get it out." So I left their office, and after that, I phoned the Dr. Blair. He explained to me everything, and he said the type of implant I have, he could not understand why I was alive. And that shocked me. After I spoke with him for an hour on the phone, at that time, I just bent on my knee on the floor. I cried my life out because he said he doesn't know why I'm alive. I should be dead. And he said, "Maybe you're still alive because you were really young when you put it inside of you, and you had a good active life, and you were eating good food also, and you seem to have a good way of living in everything I do." And he said, "Maybe it's because you had only one implant and not two." And he
Good
said,
point.
"Good point, eh?" And then he said, "Maybe it's because also they put it over your muscle and not under, close to your lungs and close to your heart." So he said, maybe those all those little things makes it why you're still alive. But it was really like not impressed, but like questioning why you're still alive. And at that point, I really understand that that was serious. And I felt like for the first time, like inside, like kind of a peace coming out, like coming into my heart, like kind of not not only peace, but sometimes something that say, "Oh, you were right all that time. You were not crazy, and there's a way out of this."
Yes.
And I felt like for the first time, instead of feeling I'm gonna die soon, I felt like there was a light coming up again.
You had hope.
And
You had hope.
yeah, hope. Yes, thank you. Yeah, hope. Like yeah, like light at the end of the tunnel. You know
Yes,
the dark tunnel.
exactly.
Yeah,
Yes.
yeah. And
So
after that, I found the doctor was gonna take
to
this
do
back.
the explant. And so you found out about breast implant illness in January of 2019, right? For the timeline.
Yeah.
And you did all this research. You went and saw your original doctor. You got a hold of this other doctor and had these amazing conversations with him. You found an explant doctor, which an explant is having the implant removed. And
Yes.
your explant was in February of 2019. So within you moved, girl. That was so awesome. You know, God just opened up the
I'm
doors
so
and
happy. Yeah.
yes. So tell us about how you got this, found this doctor and how they got you in so quickly. I mean, because nowadays, I mean, there's women that are on waiting lists for, 6 months to a year before they can go and get an explant done. I know
Yeah.
mine originally was an 8-month waiting time, but it got brought back to 2 months, right? So tell us, how did this all happen for you so quickly?
I don't know if it's just because I'm lucky. But I know it's not this. I know it's not because I'm lucky. It's because Dr. Blair on the phone said to me, your implant is really, really bad. It's a texture one and it's really no good. And you need to have a really expert doctor who knows how to do the removal with the end block technique. Because if you get a doctor who doesn't know how to do it, you can die immediately on the table, or you'll get more sick for the rest of your life and it will be a short life. And I took his word very seriously. And I said, okay, now that I have someone who believes me and explain all this, and I'm sure it's this, I said, whatever it costs, I'm going to go. Where it is on the planet, wherever it is, I'm going to go. I made some research and I've turned back to him with my research, and I give him some names that I have. And I took out the name of the doctor who was in the documentary. So can I say the name?
Yeah, you can absolutely. Yeah, you can absolutely say it.
Thank you. So it's Dr. Lu Feng, Dr. Feng. People knows her as Dr. Feng. And she's in Ohio, but I'm from Quebec, like you said before. I'm from Canada. And I said to my daughters, you know what? I'm going to write to her. So I write a long email and I phone. And in less than 5 days, they phoned me back. I could not believe it. And you know what she said to me on the phone? She said, you're an emergency case. We'll take you right away. I cried so much. I said, oh my God, I have only few days to prepare myself to fix what my daughter's gonna do and just get the money. I just turned myself quickly, and in few weeks I've done everything. I plan everything. I book a ticket to go with the airplane. I book an hotel. I prepare my luggage, and Dr. Feng sent the prescription for the blood test. And I, in those few weeks, I turned back again to my doctor and I said, here what I have. This is the email from Dr. Blair who said that my implant is morbidden. Did I pronounce it correctly?
Forbidden.
Morbidden, yeah. And he said he needs to be out. And this is the doctor that I found. She's in the United States, and I'm gonna go. She said, I don't want you to go out in the United States. I said, well, no one's gonna take me here. Who's gonna take this out? And not also who's gonna take it out. Do they know how to take it out? So I give a chance. And she said, well, go see a surgeon over here in Quebec. I said, okay. So I took an appointment, but everything was settled for Dr. Fang. I didn't cancel everything. I just kept everything there. I just went to see the doctor. And you know that doctor, what he said to me? In less than 10 minutes, he said, nothing you have, no symptoms is related to your implant. It's not possible. And he said, your file is going to be treated by our government, our authority. We have assurance, it's called la RAMQ. He said, your name is going to come soon. In a year or two, I'll call you back. And he left. He wanted to go to the door and put me out of his office. And I said, well, are you going to look at my chest? He said, well, maybe I can do that. So said,
it is why I'm here, Yeah, this is why I'm here.
And I said, what a doctor. And then he checked. He said, okay, you have a contracture,
contracture,
grade 3. So I was just about knowing what those words was meaning, the importance of it. So I wanted him to put it writing in my profile. The- Okay,
In your file? Hmm.
in my file. Right. Sorry, I'm getting a little bit too much exciting.
You're good.
Losing my words. Just gonna calm down a little bit. Uh, after I just went out of his office, I could see he didn't do nothing for me. He didn't want to do nothing for me. So I went back again to my doctor and I said, he didn't do nothing. This is what he said, blah, blah, blah. And she said, you know what? There's nothing we can do with your breast because I'm having also other patient. She's 70 and her breast is coming from the when she lay on my table so I can make a checkup for her chest. The implant is moving and it's starting to fall on her side. We just laugh of it and we put it back. And I said, are you serious? No way. No, no. So I said to her, I'm going to go. I need to make blood tests. She refused. And I said, okay, well, I need to do a MRI and I need to make an ultrasound. She agreed. And I was so glad she agreed. I'll tell you why. Because we've done it here in Quebec and the result was negative. You have nothing. And about less than 5 days later, I was at Dr. Fang's office and I had an ultrasound and they say, oh, you have all silicone everywhere in your body. Let take the pen, the special pen, like a kind of a purple pen, and he marked my body everywhere. He found silicone. And not only that, he found silicone on my liver, on my lungs, everywhere. He said, Dr. Frank cannot take it out, but I'm going to write it in your report. So I said, how come 5 days later in my own province, my own country, they say I have nothing? I just take a plane like 4 hours later and they can see it. So I was questioning myself. Is it because they have other kind of machines so they can see more? Or it's because they know what to look for? And I think that was the answer of my question. They know what to look for so they could find it.
Yes. Well, and I think they were also open to seeing something different than what they thought the problem
Yeah,
was. They weren't
yeah.
fixed minded in what they thought that they had seen. So you ended up having your explant surgery. Share with us what your results were and how you're doing today, so we can, share with the audience the good news.
I'm so happy. Yes, the good news was that Dr. Feng took everything out as an en bloc and also a capsulectomy total because she needed to go further my implant to take those pieces that we could get out. And what that was really shocking, and she said, you didn't have only one capsule, you had two capsules and you have pieces. And when my implant was shipped to Dr. Blair to be analyzed, he said this one was not broken like the first one. Remember, I had one broken. So he said that all the little pieces was from the first implant. And in my report from 1988 and 1989, she said inside that she took everything out, that it was a capsulectomy, and there was nothing left. So I was questioning again myself. Does she think she knows how to do it? Or maybe she lied. But is she allowed to lie? I don't know. So this is like a mystery. How come she write this in my file and Dr. Feng found something else? So that was shocking. And not only that she found it, when she take it out, she took pictures. So I have it. And it was shipped to Dr. Blair and it was shipped to analyze. So it's real what she took it out. She didn't invent it. It was there.
Yes.
So
Yes.
that was shocking. And immediately when I woke up, in the room where you wake up in the surgery room.
Recovery.
Yeah, the recovery. Thank you. And I had no pain at all. And now it's 3 years, passing 3 years. I have no pain at all. No, 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 no. I just can't believe it that I had 30 years of pain. To me, it's like I lost those 30 years, and those 30 years you cannot go back, you cannot take it. And those are my young years.
Yeah. And the years of your children, the time with your
Yeah,
kids, because this
of
affected
course.
your children too, your whole family.
Yes, you're perfectly right. Because when my kids was young, of course they want to touch her mommy and they want to comb my hair, they want to touch me, but I never said yes to them. And they know it today. They know, oh, my mom, we could not touch you, never. You all the time say, no, don't touch me. And not that I push them physically, but I verbally I say, no, don't touch mommy. I have too much pain. No, don't touch my hair, please. Don't touch my head. Don't touch my head. So they cannot cuddle me like a spontaneous, like a
Like
quick and
children are, yeah, when they
yeah,
want to, in
they
the
could not do
moment.
this with me. I had too much pain. And then I felt so much um, with sadness inside of me, like a guilty also, like, oh, maybe they lost something, they didn't get it, and it's my fault now. I should have known this before. I felt like guilty and responsible. Of course, it stayed only for a few months, but still, it passed through my mind, all those questions and all those mixed feeling you have. So now that I know and I feel, especially that I feel my hair doesn't, they're not lose, I'm not losing my hair anymore. I don't need my ears every day, and they get improved also. My thyroid gland got improved, so they changed my medication, and I lost my weight. My swollen is gone. I don't have pain nowhere. I don't have also the itchy. We forgot to talk about my itchy skin. Like before with the implant, I was like a monkey. itching, itching my throat, itching my cheeks, itching my breast, my belly, my feet. I was itching everywhere. Now nothing at all. Not everything disappear like it never happened.
Isn't
It's
it amazing? It's
I
amazing.
know.
Yeah.
So because I feel it inside of me, like I'm like how do you say, like I'm je suis comme une réalité vivante. I'm a reality uh, experience. I don't know if that's
An
what I want to say.
experiment. You feel like you were an experiment with the implant, or
Yes. And because I can feel it inside, I experience those feelings before and after. I know it's real because it passed through my body, you
yes.
know.
Yeah.
And so now I do like I do with you today. I speak a little bit about my experience because I heard a lady who spoke. She changed my life. So now I want to speak. I know I'm gonna change the life of someone. I don't know who it's gonna be, but I know I'm gonna touch at least one person. And we need
Amen.
to do this. Yeah, amen to this.
Amen. Thinking about your story and knowing where you are now, what is one thing, I just, quickly, what would you like to go back and be able to tell the 17-year-old Julie before she got that implant, or maybe even somebody that's considering implants today? What would you say to that person?
If I go back to my 17 years old, the little Julie, I would have said to her, go with your feeling and don't listen to people who wants to take decision for you, because I didn't take that decision. They put it to me.
Yes.
So I would have said this to her. I would have give her the the straight. I don't know if the force that I have now, I would have given to her. And if it's for other women who's thinking about having a breast implant, it's their choice, but please take information to have a consent agreement and knowing all the risk before. Check your symptoms that you have now compared to what you're gonna have maybe after you put implants. Or maybe you're gonna change your mind. If you read and listen to other ladies, maybe you're gonna make another choice. But if you still do, at least you'll know. But be careful. I think I should add that be careful because there's different ways of putting implants. We didn't talk too much about this, but there's different way of putting implants. And there's not so many ways to take it out.
Right.
So sometimes if you put it inside, not in a good way, it could be harder to take it out, or even it could not be taken out, especially for a woman who's having breast cancer. But that's another subject. And
Yes.
it's a delicate subject, but it's a subject that should be speaking out.
Yes. Well, and we are going to have several episodes that are going to be talking about breast implants and the cause of some cancers being breast implants. So we are going to be discussing that. But Julie, you have been such an amazing guest, and we are so grateful that you were so willing to open up and be vulnerable in sharing your story, your journey, basically, with having this implant that had completely changed your ability to truly live your life. And the title of your episode is you're 17 with asymmetrical breasts. What now? But Julie, where can our What Now tribe find you? You're on Facebook? Where can they follow you?
Yes, I have a Facebook page. Yes, they just type my name, Julie Christie. They can find it, and they can also find they can follow the JPAC, like under my name. They see JPAC. We're a global patient advocate coalition women who all work together to make changes, so a patient get more information and be aware of the danger of the breast implant. So we work all together in the same direction to educate.
Amazing. I love it. Thank you so much, Julie. I appreciate you, and thank you for sharing your story today.
Oh, thank you to you to invite me. Thank you very much.